Hello, I'm Dr. Lana Fitzgerald-Husek, Associate Medical Officer of Health for York Region. York Region schools are reopening soon, and many families are looking for information about what school will look like this year. As school boards and private schools announce their reopening plans, it's clear that school will look different, with specific health and safety measures in place, guided by the Ministry of Education's Guide to Reopening Ontario Schools. We know it has been difficult making decisions about whether your child will attend school in person or participate in online learning. And we know the importance of school for children's overall mental, social, physical, and emotional development. When it comes to the health of our school communities, please know that York Region Public Health will continue to play an active role in helping to limit transmission in school settings and will investigate all cases of COVID-19. We recently added a new section to our website, york.ca/safeatschool. It includes resources like fact sheets, signage, and links to other websites to help you prepare. And we will continue to add helpful information here. We have received some questions about public health's role supporting schools reopening and what may happen if there's a confirmed case in school. York Region Public Health and the school boards anticipate additional guidance from the Ministry of Health and the Ministry of Education on what would be expected in the event of a COVID-19 case in a school. In addition, York Region Public Health has built-in processes based on experience with the reporting and management of other infectious diseases in school settings. I'd like to share some information about public health's relationships supporting school reopening, contact tracing, and what happens if there is a case in a school. Public health has long-standing partnerships with public, Catholic, and French school boards and with private and independent schools in York Region. These relationships are so important as we navigate this complex, evolving COVID-19 environment. We remain committed to working with schools and school boards and supporting children, parents, and educational workers in a safe return to York Region classrooms. York Region also has good relationships with provincial partners and will continue to follow the lead and guidance of the province and provide input as required. For many years, public health and schools have worked together on communicable diseases in school settings. For example, contact tracing and case and contact management during norovirus outbreaks, pertussis or whooping cough, measles investigations, and our immunization clinics. These experiences are extremely beneficial for managing COVID-19 cases and contacts in schools. As you may know, COVID-19 can be spread through close contact with an infected person. As a reminder, examples of what constitutes close contact include being within 2 meters of a case for more than 10 minutes, living in the same household or providing care to a case, having physical contact with a case, such as hugging or shaking hands, being in contact with the case's respiratory droplets, like if they coughed or sneezed on you. We take case management and contact tracing very seriously. And while we anticipate that some cases of COVID-19 may occur in school settings, we know that we are well prepared to promptly and effectively respond. If a student, for example, tests positive for COVID-19, York Region Public Health will conduct an in-depth investigation to identify close contacts of the case. Contact tracing is an effective tool to slow and control the spread. In the school setting, close contacts are more likely to be students and teachers in the same class or cohort, siblings of the case in different grades, or other school staff with close contact with the case while the case was infectious. And close contacts outside of school will also be followed up. Public health will directly get in touch with close contacts of a confirmed case to advise on important public health measures such as testing, self-isolation, and symptom monitoring. There will also be communication with students, parents, and the school so they're updated. Each situation may be unique and evaluated on a case-by-case basis, and we will continue to follow established communicable disease prevention and control practices and additional guidance on COVID-19 in schools that is forthcoming from the province. We all have a role to play in stopping the spread of COVID-19 in our communities. Being COVID smart can help you and your loved ones avoid getting or spreading COVID-19. Teach kids to be COVID smart and stay safe this fall. Stay home if you are feeling sick. Make space around your friends and wear a mask. Always wash your hands with soap and water. Remember to cover your coughs and sneezes with your arm, and talk to someone you trust if you are feeling sad, scared, or sick. In closing, getting children back to school is important for their social and mental well-being. Our dedicated webpage has information and resources to support the safe reopening of schools and things to consider when you're deciding to send your child for in-person or online learning. Everyone's situation is different, and this decision is an individualized one for you and your family. Please visit york.ca/safe@school. Thank you all for your continued vigilance, for looking out for one another during these challenging times, and for helping keep COVID-19 out of our communities. Thank you, and please stay safe.